beta blockers, which are here acting by decreasing the production of angiotensin 2. In case of decompensated heart failure, there is another action of beta blockers. They decrease the heart rate and decrease the heart contraction also, because these beta receptors are present on the heart muscle also, okay, and SA node also. So sympathetic activity acts via beta receptors to increase the heart rate and contraction. So that also it is decreasing. Now in chronic, it is okay compensated heart failure, because same beta blockers, which are here acting by decreasing the production of angiotensin 2. In case of decompensated heart failure, there is another action of beta blockers. They decrease the heart rate and decrease the heart contraction also, because these beta receptors are present on the heart muscle also, okay, and SA node also. So sympathetic activity acts via beta receptors to increase the heart rate and contraction. So that also it is decreasing. Now in chronic, it is okay, it can work. But in decompensated heart failure, it becomes unacceptable. So it is contraindicated in case of decompensated heart failure. Now there are newer drugs which can be used in chronic heart failure as well. So one is that decrease preload, afterload, then reverse cardiac modeling. And the third one is drugs that increase that counteracting vasodilators, which are there, which I told you in the compensatory mechanisms. Let us see once more. You see here I told you ANP, BNP, PG2, PGI2. So these drugs either increase its activity or prolong its action. So actually this BNP, there is enzyme neutral endopeptidase which causes the inactivation of BNP. So these newer drugs actually inhibit this NAP so that BNP can act longer. Understanding? So that there will be vasodilation. Alright. So that was about compensated or chronic heart failure. Coming to the treatment of acute heart failure. In acute heart failure, our main aim is to stabilize the patient. So for this, what we want is basically increase the contractility of the heart, right? And second thing we want is decrease the congestive symptoms. Okay, congestive symptoms is basically the symptoms which are occurring due to the fluid overload. That is why this heart failure is also known as congestive heart failure, because fluid is jamming up everywhere. Okay, so how to increase the contractility of the heart? By giving certain drugs like dobutamine. How they are acting and all, I will not discuss right now. For that, maybe I'll make another video. So dobutamine, dopamine is there. Then cardiac glycosides is there, right? Then there are new inodilators. What are these inodilators? Inodilators are basically they increase the cardiac contraction and they cause the vasodilation as well. Then for decreasing the congestive symptoms which are occurring due to fluid accumulation, what we need to do? We need to decrease the fluid. And how to do that? By giving the diuretics. Okay, so diuretics will decrease the fluid and hence they will decrease the congestive symptoms. By the way, just one thing here, you see this dobutamine is a beta-1 agonist, because we have to increase the cardiac contractility here, right? And as I told you that for reversing cardiac remodeling, we are using beta blockers. Here we are using beta-1 agonist. Okay. So I hope you liked the video. We discussed a lot about the different types of heart failure, the signs and symptoms of different left heart failure and right heart failure and why they occur. We also discussed about the compensatory mechanisms and how treatment is aimed at these compensatory mechanisms which occur in heart failure. Thanks for watching the video. If you liked it, do press the like button, share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you. depends exclusively on oxidative phosphorylation for energy needs. Oxidative phosphorylation means that only with the utilization of the oxygen, ATP is produced within the mitochondria. So there should be a continuous supply of oxygen for the functioning of the heart. In fact, there should be a balance between the oxygen supply and oxygen demand. If there is an imbalance, then it leads to ischemic heart disease. And ischemic heart disease manifests as either angina pectoris, in which there is pain with exertion, but it zones, okay, red, brown, pericentral zones. While in the periportal region, where the port
हाँ जी, हेलो, क्या नाम है? बी बीरेन राय। हाँ जी, क्या हाल है जी बीरेन जी? अच्छा, कुछ करो लाइव में तब लोग आएंगे। अच्छा, बताओ जी क्या करें, आइडिया दो। एनी आइडिया बीरेन जी, व्हाट टू डू? कॉपी में सब्सक्राइबर्स का नाम लिखो या कुछ क्वेश्चन लिख के कुछ ना करो। अच्छा, कैसे क्वेश्चंस? हाँ, क्या लिखा है? 981 multiply 5 bracket 2 1 multiply 2.
यही सोच रहे हो ना कि इतनी एनर्जी कैसे। मैं यूज करता हूँ शिलाजीत जो मेरी एनर्जी लेवल्स को बढ़ाता है जिससे मैं पूरे दिन एक्टिव रहूं। और कोई ऐसा वैसा शिलाजीत नहीं, मेरा भरोसा है कभी बाकी शिलाजीत एनर्जी से जिसमें प्रेजेंट होता है 60% से ज्यादा फॉल्विक एसिड और 80 प्लस मिनरल्स। आप भी खरीदें
हाँ बताओ जी, फिर क्या
www.dhamija.com।
आंसर है इसका जो आपने क्वेश्चन लिखा है?
heart failure. The right heart failure is actually a lot easier. When we talk about right heart failure, it's the same kind of concept. We take this normal heart and we jack it up to cause systolic heart failure. Now, when we talk about this, it's again, you're dropping what? The contractility. So, what generally drops contractility on that right heart? Well, in the left heart, the most common cause was an MI. That's what it would be here, an MI. Okay? So generally, a right ventricular MI is going to be the most common cause, generally, of this systolic right heart failure. So you're dropping the contractility here, and that's leading to the formation of this systolic heart failure. Now, again, what you're going to notice is that this puppy is going to start getting super dilated, right? So what you're going to notice is this dilated type of right ventricle. Now, another concept here with this dilated right ventricle here is that your right ventricle, the contractility is reduced, right? So this whole right ventricle, let's say, is really, really messed up. Because it's messed up, it's going to have a hard time being able to pump blood out into the pulmonary artery, right? So it's going to have a hard time with forward flow. So what you'll notice out of these patients is that they are going to have a low right ventricular cardiac output, right? Because of the contractility. And so because of that, they're going to have this low contractility. This is going to lead to a decrease in their right ventricular ejection fraction. Now, we don't generally give these, as we compared prior, the heart failure with the reduced ejection fraction, that's primarily only consistent with left heart failure. But again, you can think about it in this particular way. But again, a reduction in contractility will lead to a reduction in the right ventricular ejection fraction. And the problem is that these patients are going to have a hard time generating a good cardiac output out of the right ventricle. And so that's the concept here. It's pretty straightforward. Something is decreasing contractility because you infarcted the right ventricle. And the other aspect over here, you have something increasing the afterload, right? So if I have something increasing the afterload, in the example for left ventricle, it was hypertension, it was aortic stenosis. For this one, it's anything that increases, I'm going to put little parentheses here, anything that increases the pulmonary vascular resistance. So
मैंने
for the
हेलो
art
भेज दी थी
systemic
हाँ
circulation,
फिर
what's called systemic
आया था
vasculitis,
जवाब सुना था
hypertension
नहीं
or
तब
aortic
तक बैक कर दिया था
stenosis.
फोन बंद
अच्छा
हो गया
अच्छा
This thing is
1% थी
causes
अच्छा
चार्जर पे है
pulmonary hypertension.
ठीक
So we say this is pulmonary hypertension. And there's different types. We'll talk about this in pulm when we go over pulmonary hypertension. But there's type 1, which is idiopathic, type 2, which is due to left heart failure, type 3 due to some type of like lung disease like COPD or interstitial lung disease, type 4 due to some type of chronic pulmonary emboli, and then type 5 is there's usually something like sarcoidosis, like something compressing the pulmonary vasculature. But this is the concept I want you to understand. Pulmonary hypertension for right heart failure, systemic hypertension for left heart failure for that diastolic type. Now, what do you notice here about this right ventricle? It's thick, right? So they have some hypertrophy generally of that right ventricle. So we say right ventricular hypertrophy. And this is usually because that ventricle is going to have to thicken to be able to accommodate the high pressure of the pulmonary vasculature. That's the only way it can do it. And so because of that, it's going to have a hard time being able to fill with blood. So the problem with this situation here is the same concept. They have a reduction in right ventricular filling, which causes them to have again, a normal ejection fraction. They don't have a problem with their ejection fraction. So they have a normal right ventricular ejection fraction. So again, decreased filling process, but normal right ventricular ejection fraction. That's the big kind of thing that I want you guys to understand here. Now, again, remember, both of these are going to have a reduction in right ventricular cardiac output. It's just, again, the mechanism behind them developing this. All right, that covers this one for right heart failure, the pathophysiology, the causes. What about this weird one? There's this weird entity called high output heart failure. And generally, high output heart failure is particularly only consistent with generally left, so the left heart. And what I want to do quickly is talk about this one. So for the most part, what you've noticed is that when we talked about left heart failure before, is that there was a low cardiac output. And then when you talk about right heart failure, there's a low cardiac output. There's this weird entity in the world where this is called a high cardiac output heart failure. You're like, what? That seems odd. It is weird, but here let me kind of explain why this happens. In this patient here, we see that their vessels are super dilated. So they have extremely super vasodilated blood vessels. So what you'll notice here out of these patients is they have a massive vasodilation. All right? And when you vasodilate vessels, that's a big thing. We'll talk about what causes, but this is massive vasodilation. All right, so there is massive vasodilation here. The question that you have to ask yourself is what's causing these vessels to become super, super dilated? And there's a bunch of different things. One reason is very common is sepsis. Sepsis will cause massive vasodilation. Another one, which is an odd one, is when you have thiamine deficiency, such as berry. This will, for some reason, cause massive vasodilation. Thyrotoxicosis, so when a patient has thyroid storm, this can also cause massive vasodilation. Other kind of interesting things could be things like AV fistulas, as well as severe, and I mean really, really severe anemia. These are particular things that in these diseases, but I would say sepsis being kind of one of the most common ones, these will cause massive vasodilation. When you massively vasodilate these vessels, what happens to the systemic vascular resistance now? Sucker's huge. Resistance has got to be low. So now their systemic vascular resistance is crazy, crazy low. Now, go back to that formula. What's the formula called? For everything with low output heart failure, we said that we have blood pressure is equal to cardiac output times systemic vascular resistance. And all of the ones that we talked about, cardiac output was low, which dropped the blood pressure. Now, in this disease process, the systemic vascular resistance is low, which will cause the blood pressure to be low. What has to compensate? The cardiac output. And that's why we call this high output heart failure.
I learned that ChatGPT works best with detailed prompts, but I hate typing them. So instead, I dictate them using WhisperFlow while walking. When I'm walking, my brain just works differently. Ideas start pouring out. But ChatGPT's native voice dictation can't handle my stream of consciousness rambling. WhisperFlow cleans it up instantly.
So then what happens is when your systemic vascular resistance drops, what it does is it creates a reflex kind of situation. So what it does, it'll drop the blood pressure. So the patient's blood pressure may drop. When you drop the patient's blood pressure, what that's going to do is it's going to activate the sympathetic nervous system and the renin-angiotensin-aldosterone system, and that is going to increase the sympathetic nervous system. Now, look at this. If I increase the sympathetic nervous system, that's then going to go in, work on the heart. And when it goes and works on the heart, it's going to work on a bunch of different components here. One is you have your SA node, your AV node, your bundles of His and bundle branches. That's all going to be active.
Today we are going to talk about the modern concepts in heart failure. Heart failure means heart fails as a pump. One of the major functions of the heart is pump the blood in circulatory system, right? But who will tell me really a good definition of heart failure? Let's talk about Dr. Nadir. Yes. What's your personal concept of heart failure? Just loudly, please. Okay, he says heart failure is a condition in which heart fails to meet the demand of the body. Let's suppose if I'm feeling very much cold and chilly, my demand is to get some sweater. Do you think if heart failed to provide me sweater is heart failure? Because your definition is not right. Is that right? So what is the definition of heart failure? Yeah, that's very important. That basically how we define heart failure. Basically, this is the failure of the heart to do its normal function. Now, for First of all, what is the normal function of the heart? Normal function of the heart is to provide the body with enough cardiac output so that metabolic needs of the peripheral tissues should be met with, right? Now, when we, under what circumstances we say that patient is having heart failure, actually we say that heart failure is present when in the presence of normal or above normal filling pressures. In the presence of normal or above normal filling pressures, heart is unable to maintain enough output to meet the minimum metabolic needs of the peripheral tissues. Right? Again, what is the basic duty of the heart? Basic duty of heart is to provide enough cardiac output so that circulatory system should be able to meet with the metabolic demands of the rest of the body. Is that right? Now, when we say heart fails to perform its function, when you have filled the heart properly, is that right? And in spite of that proper filling, heart is unable to maintain enough cardiac output to meet the demands of the body. Right? Again, let's recap what is heart failure or cardiac failure. It's a clinical pathological syndrome characterized by failure of the heart to generate enough cardiac output to meet the minimum metabolic needs of the body tissues